In speaking of the two most common that I do, the lymphedema bypasses and the liposuction, the success rate is high. In terms of lymphedema bypasses, the subjective improvement is greater than 90%. This means that the vast majority of patients will feel that their arm is less tight, less swollen, less heavy, and has less fatigability or doesn't tire as easily. Greater than 80% will actually see a reduction in the measurements or the circumference of the arm. Depending on the chronicity of the disease or how long they have had it, may determine how much of a reduction they end up having. This usually takes place over the course of weeks to months to even years. In terms of doing liposuction, the results are immediate. The downside to doing liposuction alone is that a person still is subject to wear their compressive sleeve for the rest of their life. More recently, we have been combining these therapies in which we'll perform a lymphedema bypass, and then usually 6 months to a year later, if a woman has had a chronic disease and they need to have further removal of that fibrofatty tissue, we do the liposuction later. We've had excellent success, but our long-term results are not out yet because of the brief period of time that we've been performing those in combination.